Hello, I'm Dr. Mark Dailey, and if you're watching this video, you've probably been in an automobile accident. I want to take a moment and discuss the 4 phases of a whiplash injury. Half a second is not a long time, but it is long enough to stretch nerves, tear ligaments and tendons, herniate discs, and literally slap the brain into the side of the skull. This all happens through 4 stages of acceleration. Each one is distinct and has its own damaging effect on the body. Maybe even more disturbing is that the body received substantially more acceleration than the vehicle itself. You probably don't recognize this, but the head and the neck experience over 3 times the G-force of the car itself, meaning just because the car isn't totaled doesn't mean you're not injured. Phase 1, let's talk about that. The car is struck and begins to move underneath you. Your mid-back flattens against the seat. Your body lifts towards the roof of the car. The neck and the low back is flattened, and the discs, which are the cushions between the bones, compress. The head violently moves backward, and the neck restraint will protect you to some extent, reducing the injury by 11 to 20% if it's adjusted properly, but most of the injury occurs before your head hits the seat. The axial compressive force of the spine is in the range of 33 pounds. Phase 2. Your head reaches full acceleration but continues to move forward. This produces a shearing force on the neck. So an S-curve develops in the spine. It's supposed to be a C-curve. The foot is drawn away from the brake, resulting in more acceleration. This is a dangerous situation that can result in disc, ligament, muscle, and facet damage. This facet damage often is difficult to see on imaging, like X-rays or an MRI, and can result in pain years after the accident, which is something we really want to avoid. Phase 3. The head and the neck, the head, neck, and shoulders are at peak acceleration while the vehicle is slowing down. The head and shoulders are moving forward, and the torso is forced back into the seat. The feet press back down on the brake, which makes the deceleration more violent. The shoulder restraint protects you from being ejected from the vehicle itself, but can cause contusions across the chest and the ribs. And then phase 4, this is the most damaging phase. The seatbelts cause a violent flexion of the neck. The muscles and ligaments are strained, and the fibers of the neck can tear, and the fibers of the disc can tear. Vertebra can misalign at this phase. As your head is jerked forward, the brain can smack the inside of your skull, resulting in swelling and brain damage. This damage can manifest in the form of memory loss, headaches, to name a few. Now, if you're not restrained properly, this can result in further damage by hitting the windshield and the steering wheel. But consider this. If your insurance company is trying to push you through the process and not allowing you to address your injuries, they're looking out for themselves and not for your best interest. Call our office for a free consultation. We'd be happy to give you our assessment over the phone, and then of course we'd welcome you into our clinic as well. If the auto accident wasn't your fault, then the cost of care will be covered by the insurance company, whichever one is liable, whether it's the people who hit you or your insurance company. So please be sure to take care of your personal injuries. Call our office. God bless you, and I wish you the very best of health.